Hello everyone, welcome back to the channel. That's Ben here, and in today's video we'll be starting a new series on heart failure. Thank you all for coming back to the channel. To my returning subscribers, thank you. And if you are new on this channel, I hope you stay around as this video will bring value to you. So today we will be starting a new series, like I mentioned early on heart failure, and then we would be seeking to understand the concept of heart failure and the things we need to know for the NCLEX RN exams as well. So at the end of this series, we'll be doing a set of questions just to get our knowledge up to test taking standards. So what is heart failure? Heart failure basically is your heart being unable to efficiently pump blood. So what happens is that this reduces cardiac output, and as well, it reduces tissue perfusion. But in order for us to adequately understand the concept, we need to go back and revisit circulation throughout the body. So you would realize that deoxygenated blood from the body comes back into the heart via the right atrium and then into the right ventricles. This is then pumped to the lungs for oxygenation to occur, after which blood comes back into the left atrium, then the left ventricles, and then blood is now pumped throughout the body, with the heart itself receiving some of this oxygen-rich blood. So we have established that heart failure is basically just the heart unable to efficiently pump blood. Now, what could cause heart failure? We need to understand that mainly heart failure is as a result of injury to the heart muscle itself. So most often than not, you find that the cause of heart failure is due to an injury to the heart muscles. But there are some other ones that are also very much pertinent when it comes to heart failure, and one of them is faulty heart valves. So the heart runs a one-way system, and so blood only moves forward and not backwards. And so it's got these valves that allow for blood to go through from one chamber to another, and then it closes to prevent backflow of blood. And we have four of such valves. So we have the atrioventricular valves, which usually is your mitral and tricuspid valves, which are in between the two chambers. And then we've got the semilunar valves, which are your aortic and your pulmonary valves. So that prevents blood that needs to go out of the heart into the body and out of the heart into the lungs from coming back into the lungs. So usually, what type of faults could this valve have? So they can either be regurgitation, that's backflow of blood, or stenosis. So they become quite stiff and are unable to perform the functions of opening and closing and preventing the backflow of blood. Also, you can have some arrhythmias. It can be both atrial and ventricular arrhythmias, and these ones can also lead to heart failure. We've also got myocardial infarction and coronary artery diseases. So myocardial infarction is when the muscles of the heart die because they did not have enough blood supply. And coronary artery disease is basically when there is something that affects the arteries that supply the heart itself. Other causes of heart failure can be congenital. So most people born with some congenital heart disease or heart defects may end up in the long run suffering from heart failure. Uncontrolled hypertension is also one of the main reasons why people develop heart failure. This is because the heart is having to pump against a greater pressure, which it's normally not used to. And finally, on this list of those things that can cause heart failure, recreational drug use and alcohol abuse are also found to be some causes of heart failure. Now we move on to types of heart failure. So we've got the right side of the heart and we've got the left side of the heart. Both sides of the heart can actually fail. So you can have either right-sided heart failure or a left-sided heart failure. And as the name suggests, these ones are specific to either the right side or the left side, and it's usually the ventricles that are affected. And I need to say that either type of heart failure can either be a diastolic heart failure or a systolic heart failure. What this seeks to explain is that the failure could be at the pumping stage or at the relaxing and feeling stage. Now let us look at left-sided heart failure. So we established earlier that it is mainly on the left side of the heart and it's mainly the left ventricles. So what happens in heart failure is that there is a backup of blood into the lungs. This is because oxygen-rich blood comes from the lung into the left ventricles. And so when the left ventricle is unable to pump properly, there is a backup of blood because the blood that comes to it is unable to leave the ventricles into systemic circulation. And this is the most common type of heart failure. And these type of heart failure can actually lead also to right-sided heart failure. Now, I mentioned earlier that it can either be systolic or diastolic. Now, the ventricles being unable to squeeze properly gives you what we call a systolic failure. And that is what we measure, what we refer to as an ejection fraction. So an ejection fraction is the amount of blood that is being pumped outside the left ventricles when it is actually filled. So you realize that if the left ventricle is 100% filled, if you're able to pump more than 50% of the blood, then we say you have a normal ejection fraction. Now, anything below 40% of the blood being pumped out, it is indicative of some form of heart failure. And heart failure can be from mild to moderate to severe, depending on your ejection fraction. So in diastolic heart failure, the ventricles literally are quite stiff and unable to relax properly. So what happens is that the ventricles are not able to fill well with blood that is coming from the lungs with oxygen-rich content. Now you realize that because it is just the ventricles being stiff, the ejection fraction in diastolic heart failure is usually normal. This is because it doesn't have a problem with squeezing, but it has a problem with feeling. And so the signs of symptoms of left-sided heart failure usually are pulmonary in nature. The reason is that because there is blood backing up into the lungs, you realize that the signs and symptoms you see would usually be pulmonary in nature. So for right-sided heart failure, what we see is a similar thing happening in the left side of the heart, but this time around, it has to do with deoxygenated blood that needs to go into the lungs for oxygenation. So there is usually a backup of blood, this time into the peripheries. The reason is that the right ventricle receives blood that has already circulated and is deoxygenated from the inferior and superior vena cava down into the right atrium. So part of the heart is unable to pump adequately. You realize that there's a backup of blood, and usually it goes into your periphery, so your arms and your legs, your abdomen, and sometimes your liver. And we need to establish that it is usually as a result of a left-sided heart failure. So what signs and symptoms should we expect when someone is actually having heart failure? So we look at the left-sided heart failure and we look at its signs and symptoms, and then we'll look at the right-sided heart failure and its signs and symptoms. The reason why we separate this into two is because one can occur independently of the other. But usually, someone with left-sided heart failure would advance into right-sided failure, and then the person can experience both symptoms. So the first one would be difficulty in breathing, as well as crackles on auscultation. So when you listen to lung sounds, you find a lot of crackles, and the person now struggles to breathe. The reason is because there's backup of blood in that lungs, and so there's not enough space for the lungs to expand and deflate and to allow for exchange of gases to occur. There's also usually autopnea and weakness. So autopnea basically is that when you lie down, it is very difficult for you to breathe. And that is because you realize that with lung disease, it's usually advised that the patient is sat upright to allow the abdominal content to come down a bit for the lungs to expand. And also there's usually weakness and fatigue. The body needs oxygen to go about its normal activities, and with less oxygen, there's usually tiredness and fatigue. The other thing I want to talk about is tachycardia. So usually, because the heart senses the body is not receiving enough oxygenated blood, you realize that in an attempt to compensate for what is going on, the heart then tends to beat faster, and that leads to what we call tachycardia. You would also get a cough, which is referred to as nagging cough, and it can either be blood-tinged or frothy. And then last one is weight gain. So we realize that because there's backup of fluids, there's usually weight gain, which can be up to 5 pounds every week. Now, moving on to right-sided heart failure and its symptoms. We mentioned that there is backup of blood in the periphery. So usually you find swelling in the legs, in the hands, in the abdomen, and sometimes in the liver. There's usually weight gain. There's also what we call the jugular vein distension. So jugular veins usually are seen in the side of the neck because there's backup of blood into the peripheries, and then the jugular veins carry blood into the right atrium. You realize that this one's become a bit bulgy and it's very visible for you to see. You also will experience some atrial fibrillation. That is just the atrium not contracting properly to allow for it to fill and open for blood to go into the ventricle. You would also experience atrial fibrillation. And then finally, we find edema, which is usually P-eating. So that is just swelling in the periphery. So once you put your hand into that edema, you realize that it takes longer for the skin tegel to return to normal. So aside the signs and symptoms that we have established, how else do we confirm someone is having a heart failure? So there are certain tests we can do, and these ones will help us to indicate whether there's heart failure and even its severity. So the first thing we do is the BNP, which is short form for B-type natriuretic peptide. So this is a biomarker that is released when the ventricles are stretched excessively because there's pressure in the heart. And usually for normal BNPs, it's below 100. Anything above 100 is indicative of heart failure. But if you get BNPs above 900, then it's indicative of very severe heart failure. You can also do chest x-rays. You can do an echo. So an echo is just basically when you put a probe to check the activity of the heart, and that's how you measure the ejection fraction mostly. Then we've also got what we call the nuclear stress test. So what happens is that you are injected some radioactive material, and then we do an imaging whilst you are exercising to see what the blood flow is like, and then that can help us determine whether one is having heart failure or not. So finally, I want to say that heart failure can either be chronic or acute, and usually it is exacerbated. It is triggered even more by either an infection, renal impairment, sometimes uncontrolled atrial fibrillation, which is actually a sign of right-sided heart failure. When it's uncontrolled, it can exacerbate or make the heart failure you're experiencing worse. And also, high fluid and salt intake can also contribute to you exacerbating your heart failure. So in today's video, we've tried to establish what heart failure is, what the types of heart failure are, what signs and symptoms one should expect, and then how do we diagnose heart failure and what things can trigger or exacerbate this condition. I hope you had value for your time. Thank you for sticking to the end. If you've got any questions, any concerns, do what to leave a comment down below, and we would come back to it and address it as needed. So this is a part of a series we've started on heart failure. So if I've not covered anything in today's video, look out for subsequent videos, because we'll be doing a long series on this, try to understand it. And we want to keep the information brief and simple to each video, so it's easier for us to understand and follow along. You also want to like, share the video, subscribe, and comment below. Thank you for staying with us, and we'll see you in the next one. Bye-bye.